This is In Business with Almanac North. I'm Ken Bueller. Thank you for joining us. You know, medicine used to be a whole lot simpler back in the day. A person became a physician, moved to a small town, hung up their shingle, and practiced medicine the old-fashioned way. You know, like Dr. Galen Adams in Gunsmoke, played by Milburn Stone. And who could forget Dr. Quinn, medicine woman, played by Jane Seymour? Oh, I was in love with her. That simple, old-fashioned kind of medicine, one doctor, one shingle, one office. In my hometown, it was Doc Lee. He had an office. He had a receptionist. He had a nurse. Well, she wore a uniform. We didn't really know what her medical skills were, but she did have the uniform. In Duluth, William Bagley made a difference in our community. Dr. Bagley and his associate practiced medicine here in Duluth in the 1930s and 40s and were quite successful, as in the Bagley Nature Center at UMD. Their office probably looked like this, which was like many of the small-town doctors across the country back in the day. You got a medical degree, moved to a nice town, set up a practice, and became influential in your community because you were taking care of the healthcare needs of the citizens. Well, that's all changed. We are in mega conglomerate medicine today. It's worth trillions of dollars a year, what we spend twice as much on individual healthcare in America than any other industrialized country around the world. It's big business, and it's all about to change because in a week and a half, on December 31st, the ACA, the Affordable Health Care Act, could expire. And with it goes subsidies that have been around since the pandemic to help people pay for their health insurance. Without those subsidies, what are 22 million people going to do? That is the big question. And that's what we'll talk about on In Business with Almanac North. We have experts from Washington, D.C., from here locally at the University of Minnesota Duluth, and we'll tell you what could possibly happen if ACA expires, as it might at the end of this year. And because it's the holidays, we're going to take you on a sweet treat to a confectionaire known across the region that dates back to 1905 and talk about candy stores of the past, because this is the sweetest time of year. So stay with us for In Business with Almanac North. Welcome to In Business with Almanac North. I'm Ken Bueller. Tonight we're examining a major federal policy issue that could have serious consequences for small businesses, workers, and rural communities across Minnesota. The subsidies under the Affordable Care Act might expire, and what happens next could impact how employers attract workers, how families afford health care, and how rural hospitals stay open. We'll start in Washington, D.C. with a nonpartisan organization that tracks federal policy and translates it into real-world impacts for states like Minnesota.
My name is Benga Ajilori, Chief Economist for the Center on Budget and Policy Priorities.
Well, thank you very much for joining us on the program today. Let me ask you, if the ACA is not renewed and expires at the end of the year, what changes and what changes the fastest?
So what's going to change the fastest is the premiums that people who are currently on the Affordable Care Act are going to pay. So over the last couple of years, they've had the premium tax enhancements, and that's kept their premiums a little bit cheaper. But starting January 1st, they're going to start paying the higher rate because those tax credits have now expired.
And you said that small businesses are particularly vulnerable to this. Why is that?
So one of the best things about the Affordable Care Act is that it provides options outside of being employed for health insurance. And so the ACA provided opportunities for small businesses and self-employed workers to be able to do it. There's numbers about 5 million self-employed workers and small businesses who have been using the Affordable Care Act. And so now their costs are going to go up, which is tough for small businesses.
And totally, they're talking about like 22 million people being affected by this?
Yeah, so we have 22 million people who get health coverage through the Affordable Care Act. And so because of this, we've had estimates of 4 million people are going to lose coverage because it's just going to be way too expensive.
ACA, of course, is entitled for lower income individuals. But if ACA goes away, could higher income people be affected by this, and how?
Yeah, so while we focus on low-income people, they sometimes have options of Medicaid. But with the ACA, we'll look at people who are 400% of the federal poverty level. So it hits a lot of middle-income folks who have been using that for the last couple of years.
This is In Business with Almanac North, so we try to have a focus on business. So small business is priority across our region because that's, like most of America, who employs most of the people in America. What is the ripple effect to small businesses when it comes to their ability without ACA to hire and retain employees?
Yeah, so the biggest problem is that now their costs are going to go up. And so when the cost goes up, we know with small businesses, they have already thin margins, so they have to figure out how do you adjust. And so a lot of it, they're going to have to drop health coverage. Other things, they may not be able to hire as many people. It's just going to make things a lot more difficult. And we see that small businesses already have been squeezed this year because of the tariff regime.
Expansion for small businesses, obviously that's an issue. If you can't hire more people, how do you expand?
You don't expand. What you do is you just try to maintain and try to get through this. And so this is why it's so difficult. The reason why we don't have this, expansion of credits to keep their costs low.
Benga Angelori is our guest right now. We're talking about the possible expiration of the ACA benefits. And I want to know exactly if these go away, how does that affect hospitals that maybe are now going to see people later in their illnesses?
It's a very good point. One of the biggest things with hospitals is that they are going to see people, they're going to serve people, whether they have health insurance or not. What health insurance does is that it helps keep their costs low. So now you're going to have a lot of people who are going to drop their coverage. You mentioned the small businesses, but they're going to get sick. When they get sick, usually if you have health insurance, you're going to take care of it quickly. If you don't, you're going to try to wait it out, try to see, oh, well, I'll be okay. But then if it gets really serious, then you go to the hospital. It's much later. It's going to be more expensive. And then what ends up happening is that they'll take care of you, but now you have all these uncompensated care costs for the hospitals. That's going to impact their financial viability, which is a big case and a big issue, especially with rural hospitals.
That's what I was going to say. This is going to affect smaller rural hospitals much more than the huge, big mega complexes.
Exactly. And this is something that we've seen over the last 20 years where we've had not just rural hospital closures, but the ones that stay open, they have to figure out what they're going to do with their services. And so sometimes they cut services. And usually the one that gets cut is OBGYN services, which then have a ripple effect for rural communities.
We talked about workforce stability just a moment ago. What can a business do to counteract this? What can a small business owner do to say, how can I still attract people without this ability to have them have some health care coverage?
It's going to be difficult. And so you have to find ways of making your workplace attractive and understand that, you don't have health coverage at the moment, but there are other things that we could do, maybe certain perks. But ultimately, what you have to do is just advocate for yourself, for your business, and talk to your representatives because that's what they're there for. Talk about this, tell the story about how important this is so that they understand this.
Mr. Angelori, I want to ask one more question, and that is going forward. So let's say the ACA does expire as it's expected to at the end of this year. What can a small business owner, and I'm more thinking about like farmers, individuals who are self-employed gig workers, what can they do to prepare for this in the very short time it's going to take before this hits?
So the thing is to think about savings, to think about prioritizing what are the important expenses that you have. And, a lot of times, the difficult thing is they're already on thin margins. They're already making the best decisions that they can. This is going to make it harder for them. And that's why I always go back to advocate for yourself, advocate for your community, talk to your representatives, tell the story, and tell them why this is going to be important for you to be able to keep your costs down and have health coverage.
Benga Angelori is the chief economist for the Center for Budget and Policy Priorities. Thank you very much for your time.
Thank you for having me.
For 15 years, the Affordable Care Act has been a major feature of the U.S. healthcare system and a frequent subject of political debate. This is In Business with Almanac North. Thank you for joining us. Passed in 2010 without any Republican votes in the final House or Senate passage, the Affordable Care Act, also known as Obamacare, created health insurance marketplaces and income-based subsidies to help Americans afford their insurance coverage. Those subsidies were temporarily expanded during the COVID-19 pandemic. Under current law, the enhanced subsidies are set to expire at the end of this year unless Congress acts. Last week, the Senate considered two separate proposals, one backed by Democrats to extend the enhanced subsidies, and the other backed by Republicans that included health savings account provisions. Neither measure received the 60 votes needed to advance. The House has not yet voted on extending the subsidies, though a discharge petition has been filed that could force a vote on the floor at a later date. Without Congress heading into recess, though, no legislation has been passed so far. According to federal estimates, about 20 to 22 million Americans are currently enrolled in health plans through the ACA marketplaces, and most receive some form of subsidy to help pay their premiums. Economists and health policy analysts say the expansion of the enhanced subsidies would likely lead to higher premium costs for many enrollees and could result in some people losing their coverage. To discuss the potential economic effects, we're joined by University of Minnesota Duluth economics professor Jennifer Schultz. Professor Schultz, thank you for being here. One of the courses you teach is healthcare economics. What are the economics of the ACA, and more importantly, is it working the way it was intended to when it was approved 15 years ago?
Well, that's a great question, Ken. I'm glad to be here tonight. So this was the biggest reform since we passed Medicare and Medicaid in 1965. And the phase one of the Affordable Care Act was to expand coverage, get more people covered, and it was very successful at doing that. It cut the number of uninsured by half. So today, 40 million people benefit from the ACA, either through the individual market, like you mentioned, or through Medicaid expansion. Now, phase two was supposed to address healthcare costs and reduce that growth. And Republicans in Congress spent so much time trying to repeal the ACA, I think it was like 97 times, that they really didn't get to work on phase two and address healthcare costs. But yes, it was successful at expanding coverage and providing those subsidies to address affordability.
If it does end at the end of the year, what are some of the alternatives for these people that are currently getting coverage, and more importantly, subsidies to help pay for it?
Yeah, so right now, it doesn't look like Congress is going to pass an extension until maybe possibly next year. So individuals are going to end up paying probably double what they have been paying in the past with subsidies. It's been forecasted that about 10 million people will lose subsidies, and another potentially 5 million will become uninsured because they can't afford the premium. So for those individuals, they may qualify for Medicaid, and if they don't, they'll probably be relying on community health centers that have very low rates or free care, and then charity care from our local hospitals.
The detractors of ACA say it's costing $35 billion a year for these subsidies, and that's unsustainable. Is that number accurate?
Yeah, so the CBO, Congressional Budget Office, nonpartisan, they've estimated that will be about $16 billion next year if they continue the enhanced advanced premium tax credits. And the cost in 2024 was about $14 billion. Now they've estimated it was $350 billion over 10 years, but it's about $16 billion if they extend it 1 year, which is a rounding error for our federal budget because it's about 0.02% of the $7 trillion we spend. So really, it's not expensive relative to all the federal spending. And, we subsidize large corporations of $180 billion. They get corporate tax rebates and subsidies and deductions and exemptions that, could total $1 trillion. So, $16 billion isn't a lot. And I know President Trump just handed Argentina $20 billion. So personally, I'd rather help Americans afford health care than help bail out countries like Argentina.
Let's talk about the elephant in the room, who I understand has a broken leg, is needing high-cost medications, and is going to be on long-term care. And that, of course, is health insurance itself and why it's so expensive. What's the economics behind the high cost of medicine and the high cost of insurance?
Yeah, well, these subsidies really just kick the can down the road. We really need to address the high health care prices. That is why we spend more than twice as much as other countries on health care. So the answer is simple. We have higher medical prices. But trying to solve that is more difficult because every dollar we spend in healthcare is someone else's income. So there's a lot of stakeholders involved. So politically, it's been very challenging for our elected officials to address high prices. And we have high prices because we've seen very large amounts of consolidation in healthcare. So we have monopoly pricing in hospitals and pharmaceuticals and medical device industry. So we really need to tackle that underlying problem of why we have high health insurance premiums. It's because we have high medical prices.
We're talking with Jennifer Schultz. She's an economics professor specializing in healthcare at the University of Minnesota here in Duluth, and this is In Business with Almanac North. This is a business program, so what can a business owner do, in your mind, to prepare if the subsidy is gone at the end of the year?
Yeah, so small businesses have been really struggling to afford health insurance, and so when these exchanges came on, I think it was a great service to small businesses. 160 million Americans get their insurance through their employer, and it's still expensive. I think a family of 4 spends about $27,000 in their health insurance premiums. So employers are really struggling, and if tomorrow they could be offered an option where they didn't have to be providing health insurance coverage, they would all jump at that. And they would save a lot of money. They could make that spending and increase their employees' wages and other benefits if we had an alternative choice. In Indiana, businesses are getting together. They formed the Indiana Business Health Collaboration. I encourage businesses to get together, figure out why they're paying high prices, and really put pressure on providers and drug companies to reduce prices. But they need to know that information first, and I would recommend that they look to Indiana to see what they're doing.
Jennifer Schultz, thank you very much for being with us. She is an economics professor from the University of Minnesota Duluth. We're glad you were with us. We started our program this week with a nostalgic look at the way medicine used to be practiced, with family doctors hanging their single shingle out and caring for almost every aspect of their patients' medical needs from cradle to grave. We visited Dr. Bagley's imagined office and exam room, portrayed at the Lake Superior Railroad Museum by the St. Louis County Historical Society in their Old Town exhibit at the St. Louis County Depot. Dr. Bagley was one of those small-town doctors in the growing city of Duluth from back in the day. There were many others in towns and cities all across America. We reached out to the Minnesota Medical Association to find out if there are still any single shingle doctors left in the state of Minnesota. They found 2. One is in Cold Spring, Minnesota, and the other MMA single practice physician is even colder. He's up north in International Falls at the One Doctor Northern Plains Family Medicine and Behavioral Health PC. They call him Dr. Gray. International Falls isn't really a small town, but you have a small town approach to medicine. What is it?
Well, one of the things is that you can't always cure, but you should care. And one of the more important things is the relationships with people. And sometimes, and it's not just the it's not just the medical part of it, but that aspect that makes the relationship, the healing relationship, kind of special. You need to get to know people and them know you.
What's the most difficult part about being a single shingle doctor in International Falls?
Well, let me put it this way. I think I mentioned before, I couldn't run a lemonade stand, and I took this thing on. And I knew how to be a physician, a doctor. I knew how to take care of people. And I'm not going to be the richest man in the graveyard, that's for sure. And so if you are kind of looking at what I'm doing, you kind of need to have your priorities correct. So part of the issue my first year, I mean, I'm doing everything, my own credentialing, working with the insurance companies and so forth. Now I have a billing service, and it's pretty good that I went through that process. But I did not, and it's one of the areas I think we can do a better job of preparing people like myself for the business side of this. And, you know, there's like crazy rules. I can do the same thing as some of my colleagues at some of the local institutions. Yeah, they get paid more and stuff because of facilities charges and all this sort of stuff. So I don't even get paid at the same rate. But what I wanted to do was keep my doors open. I would say that financial part, but on the other hand, you really have to appreciate it. At least I do. I'll put it this way. I'm poor as a church mouse, but happy as a clam.
Dr. Gray, a single shingle physician practicing on his own in International Falls with quite a history and quite a reputation. We're very glad that you shared both of those with us. In the meantime, thank you for your time today, and stay warm and stay local.
I appreciate this opportunity, and if anything, I hope we can encourage others to follow this path.
Before we get to tonight's final story, let's take a look at some of the top business headlines making news across the region this week. Beginning January 1st, 2026, new protections go into effect to help business owners recover from business identity theft. The Business Filing Fraud Prevention Act gives the Minnesota Secretary of State new authority to quickly investigate and correct fraudulent filings. For the first time, business owners will have a direct way to file a declaration of wrongful filing without having to go to court. MnDOT has been awarded $17.9 million in federal grants to upgrade rural bus fleets and transit facilities. The funding will replace vehicles aging and transportation fleets that are not as clean as new ones burning propane technology, and they'll do this all across northern and rural Minnesota. All legal work is complete now for Elite to become part of the Canadian Pension Plan Investments and Global Infrastructure Partners. Elite will remain headquartered here in Duluth with local management and no rate impact for customers. Shareholders will receive $67 per share in cash. How does it go this time of year? I, in my kerchief and monitor cap, had just settled down to a long winter's nap. Something about blah, 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 blah. The children with visions of sugar plums danced in their heads. Candy and the holidays go together. And the old confectioners of the past, like the Gramps Family Candy Kitchen in Loyal, Wisconsin, they were institutions in your community. And I'm going to tell you about a few others as well. Let's go inside. The Gramps Family Candy Store in Wisconsin wasn't the only old-fashioned confectioner in the day. I remember one in downtown Superior on Tower Avenue, Gennard's. They shipped their candy during the holidays all over the world. They were that well known. They were located right next to the old Beacon Theater. I remember going next door to Gennard's, buying our popcorn, and then sneaking it into the theater because, well, he used real butter and it was just so much better. Most of these old-time candy stores are gone now, except for one in our own backyard, a confectioner dating back to 1905.
Okay, well, I guess I'll start. It was originally started in 1905, and that makes us Minnesota's oldest continuously running candy store. And it was started by 4 brothers. One was my grandfather, Gus, and his other brothers, Chris, Nick, and Tom. And they started the store in 1905, and we've been here ever since. My dad was the second generation of my Uncle Leo. Then they sold it when they retired in 1982 to Jim Chena, who had it for 36 years. We bought it back in 2018, back into the K-Lake family. It's been a fun adventure ever since. My dad loved the store, and he became more and more nostalgic for it as the years went by, and he lived to see our other store open in Knife River, Great Lakes Candy Kitchen, which opened in 2007. We started that one because we were nostalgic for the family history and the candy. We wanted to learn how to make all the candy. So when this one came up for sale in 2018, Jim was retiring. They're like, well, we know how to do it. Let's do it. So we're happy we could. He always says that the turtles are our slowest mover because when you think of turtle candy, it's turtle, but it's actually, they move fast out of it. This is a pan of our famous caramel pecan turtles that's coming out of our cooling belt, which is about 30 feet long. And that's hamming to get them pulled down quicker. But the turtles are all made by first layering a layer of the pecans first, and then they cook the caramel in the copper kettle, and then once the caramel's done, the candy maker will take a funnel with a stick and put the little circles of caramel on next. And once that cools, then they'll go with the same funnel and dip little circles of chocolate on top. So that's it. And then when they're ready to pack them, they just come right out, and they're a beautiful thing to see. Hot air is our biggest seller, and then the turtles are the next biggest, and then we have a lot of popular candies in between. People love our fudge, our toffee, our caramel apples. We now have dipped wild rice that's been popped and dipped in chocolate. We learned it from the Net Lake Reservation, and they told us we could use the recipe, and that's been really popular here. And we just like preserving the history of the store, our family history. It's been very, very nice. Well, it came from my dad, actually, and my Uncle Leo. They just brought home that enthusiasm, the passion for it, that it was part of their family. My dad, both Leo and John, who was my dad and Leo's my uncle, they grew up in the candy making. They weren't like us. We didn't really work here that much as kids, but they had to work here, but then they loved it at the same time. So part of their family. And then they loved showing it off to people and giving them tastes, and everybody agreed that it was some of the best candy they've ever had. So it's a pride thing. So they brought that pride back to us. But they also said it was a lot of work. And so we were warned a couple times that it was too much work. So when we opened our store in Knife River in 2007, my dad said, be sure to get enough help. And that kind of got me, because I thought, yeah, my dad always worked too hard probably. So we decided we won't overwork except for the holidays, which will be all overwork. It's something we just can never get enough help to get everything done. So we're here a lot in the holidays, and then we live in Duluth, so we're home quite a bit in Duluth during the week. We are of retirement age, but we're enjoying the store very much.
It's we have to keep this thing rolling for another 100 years. It has to go, because
I agree.
Yeah, so that's what our goal is to do, and we're going to have to just keep it rolling. It's fun, and there's nothing, what else would we be doing,
We enjoy it because there's been many people coming back, and they're reliving memories when they were kids. They'd come in through the back door for lunch hour during high school. They would spend their lunch money on a bag of chips and a soda fountain drink, in the Green Rivers and the Cherry Cokes, and we hear memories like that. Yesterday we had a lady that called, and we know her, but she said, I worked here 72 years ago. So it's just amazing that people keep their memories alive, and they can kind of relive them a little bit when they come in. It's been over 100 years, so yeah, let's keep going. So all we're doing is for the next generations to keep it going.
For the next group.
Yeah.
We got to make it easy for them.
At our age, that's a really great accomplishment, we feel, for our family, to just keep their legacy going.
Yeah.
I'm Ken Bueller. Thanks for watching In Business with Almanac North. If you missed any parts of tonight's show, you can always watch it at pbsnorth.org or listen on Mondays at 5:30 on the North 103.3. Thanks again for watching, and until next time, let's take care of each other.